I listened with interest to what you were calling foundational treatment. I usually advise my patients to take a multivitamin. Isn't that good enough? I feel like we're adding to the number of things that a patient must take in order to get healthy. A valid concern. A valid concern. All right. Like we talked before, a multivitamin, unfortunately, many of my more traditional colleagues will say, okay, take a multivitamin, and they send them off to the pharmacy or chemist or whatever. And they pick out, some multivitamin tablets, and that doesn't work too well. It doesn't do anything. So you can recommend specifically the multivitamin you want them to take. But if you, let's say, want to engage in this whole foundational treatment, you can combine products. Okay. There are liquid multivitamins and liquid, butyrate, and they can just take it all in a shot at once. Okay. If you're judicious and you're creative, you can actually minimize the number of things somebody must take and still achieve the same goals. But what's hard is to get this concept into the way that other people treat. In other words, popping this in where instead of just, oh, go take a multivitamin, saying, okay, why don't we do this stuff, and making it palatable for the patient. And you'll find that your, protocols will work better because the cells are working, because the biochemistry is working, because you're not going to have to fight that. So if somebody's taking an SSRI, let's say serotonin reuptake inhibitor, and they're not getting better after a while because that doesn't address the creation of serotonin. Okay, guess what? You know what you need to do? Not only give, your patient 5-hydroxytryptophan, but attend to what is the usual reason that serotonin is not being created. 80% of your serotonin is created in the gut. So treating leaky gut syndrome improves your serotonin production. Why is that? Because the enteric nervous system, that nervous system that's in the gut, okay, the serotonin is the primary neurotransmitter of that system. And sometimes I've treated people with 5-hydroxytryptophan and their gut problems went away because that was the main problem. So the protocols or the suggestions I made are not etched in stone. They should be utilized as the clinician or the patient feels is best. But I do say that if you do this, you'll get better responses, because a lot of the reasons why treatments don't work is because the body or the cells / tissues / organs / body are not working either.